we shall get started. It's a few minutes past the hour. A very warm welcome to everyone who is joining the SIMNA event, where we are exploring the impact of supportive housing. My name is Christina Baggett. I am a director at Urbis, and I'm a member of the fantastic SIMNA Victorian Organising Committee, who is hosting and organising this event today. Before we go any further, I would like to acknowledge country. Today, I'm in Naarm on the country of the Wurundjeri Woi-wurrung. I would like to pay respects to elders past and present. I'd like to acknowledge the thousands of years of care and custodianship of the land and acknowledge that sovereignty was never ceded. We know that you are joining us from different parts of Australia, so we'd love to hear what country you're on today. So please feel free to add that to the chat function, just to let us know what country you're on today. Now, folks, the focus of today's session is obviously on housing, and very specifically, it's on supportive housing. We are absolutely thrilled to have four fantastic speakers who will be exploring different housing models, and really interestingly, each supportive housing model that we will be exploring today uses a different social impact measurement approach. So today, and next slide, please. Today we have four fantastic speakers. So we've got Tamika Thompson from Hutt Street, who'll be telling us a bit more about the Aspire program. We have Natasha Reeves from Think Impact, who will be telling us a bit about the Hope Housing model. And then we have Melinda and Samiha from Launch Housing, who are going to unpack a bit about the very well-known Common Ground model. There's a little bit more info about each speaker that we've just popped into the chat. So if you'd like to use that as a reference, please do throughout the presentation. So each speaker will be exploring and explaining a bit more about the core model of the supporting housing model and the impact measurement approach, key findings and learnings. After hearing from each speaker, we're going to have a bit of a facilitated question and answer. So I've got a few questions, but we'd also really love to hear from you. So if you have any questions throughout the presentation, please feel free to pop it into the chat. And as you do, please specify if the question is specific to a certain supportive housing model, or if you'd like to direct that to a certain speaker. Would also love to hear your questions if they are broader and for all panel members. Just a little bit of housekeeping before we go forward, that we will be, and we are actually recording this session. The recording will be made available to you via email, probably next week or so, and we'll also be sharing links of the reports in the email. Thank you all for muting yourself. As we said, please feel free to use the chat function throughout the presentation. Next slide, please. Before I hand over to Mika to tell you a little bit about the Aspire model, we just wanted to acknowledge from the outset that housing is obviously a huge issue, and there are many, many topics that we could explore. For today's presentation, though, we wanted to specifically focus on supportive housing. And we'll just go to the next slide as well. That supportive housing, just to make sure we all are on the same page in terms of what we are focusing on, what supportive housing is. Fundamentally, it's a form of community or social housing where specific supports are integrated and embedded into the housing model. So it provides a higher level of care and support for people with particular needs. Some of the models that we're going to hear about today have a specific focus on the specific needs of those experiencing or who have experienced homelessness, but also young people. But supportive housing models, there are many of them, and they some models focus, for example, on victims of family violence who are escaping family violence. but also models can be specific to NDIS participants, the elderly, and those with specific mental health challenges. So hopefully that was a helpful sort of grounding in terms of what supportive housing is. And without further ado, I'd like to hand over to Tamika Thompson to tell you a bit more about the Aspire program.
Hi, everyone. Thank you so much for having me here today. As Christina said, my name is Tamika. I'm the Aspire Program Manager and Clinical Lead at the Hutt Street Centre. I am joining you from Kaurna Land here in Adelaide, South Australia. So just paying my respects to Elders past, present and emerging, and acknowledging the land where our services are located. I would like to start by giving you a little bit of context and telling you a little bit about Hutt Street Centre. So on the screen, we've got our model of care. So Hutt Street Centre's mission is to end homelessness, and it's a place of connection, support, where people facing homelessness are empowered to rebuild their lives, rediscover their identities and reconnect with others. We have been operating in Adelaide for 70 years this year. So we've had lots of little celebrations, well, commemorations. We, I guess, don't want to celebrate that we're still here and still needed, unfortunately, but acknowledging our 70 years of service to the homelessness sector. We have primary care, which is operated through our Wellbeing Centre, where it's sort of a Maslow's hierarchy of needs, where people's basic and immediate needs are met. People can come in for meals. We serve close to 40,000 meals a year. We have showers. We have phone charging stations. We can be a postal address for people who are sleeping rough and don't have a fixed address. I guess it's all those sort of basic urgent things that people need to get by. And then through our centre, we can connect to lots of different visiting services. We have over 20 visiting services that come in, like doctors, nurses. We have Services Australia. We have Centrelink, which is an absolute blessing. I'm sure we can all empathise with, having a lot of stresses in our life and having to sit on hold for hours on end and remaining calm and patient when things are probably in crisis for us is not easy. So it's much nicer to have somebody in person who can sit down and have a chat with us and understand where we're coming from. From that point, so the basic immediate primary care, we can move through to secondary care, where people experiencing homelessness can access short to medium term case management support. We have an intake and assessment service. Here in South Australia, our homelessness sector operates in an alliance model. So we are part of one of a number of alliances here. And so people can come in and have an intake and discuss what their needs are and be connected to a worker for that short to medium term support. And we also have what is called Age City Living program here at Hutt Street Centre, which supports people who are 50 and above, which is quite young. But unfortunately, what we know about homelessness is that people do experience premature ageing, chronic health conditions, among many other complexities in their lives. So we have a medium-term case management team there that can support people with their goals. Beyond secondary care, we have tertiary care, which is where Aspire fits, which is what I'm focusing on today. Aspire operates 3 years of case management support, so long-term case management support, which is pretty unheard of in the homelessness sector, I think across most of Australia, but definitely here in South Australia. And we have wraparound supports and a term that we call homefulness here at Hutt Street. So what we look at is ending homelessness is more than a house. It's more than the bricks and the mortar. It's around what gives people meaning and purpose. What is it beyond the house? What keeps people in a property? What keeps people feeling well and healthy and happy and safe? So we look at that really big picture around what wraps around the individual, essentially. What I'd like to talk to you about today is starting off by talking